The illusion, again to them, is very real, and its collapse feels like an internal death. Why so severe, you may be asking? Because it's the very scaffolding. That's the thing I've been calling a patch. It's the thing that holds together their self-esteem, their sense of meaning, and their emotional survival to some extent. Hello everyone, welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. If you've been following along, you know this is the fourth episode in our series on Healing Narcissism. We've been diving deep into what real change looks like beneath the surface, not just shifting behaviors, but transforming the inner emotional landscape that drives narcissistic defenses, and in particular the defense of grandiosity, also known as the grandiose sense of self, as you may have heard me say in prior episodes. I've actually found this deep dive into healing to be really fun to record, and honestly, I could keep going. There's so much more to say about treating this very complicated condition. This could easily become its own podcast in and of itself, just on how specifically to work with and heal all the different aspects and dynamics that make up narcissism and the grandiose, omnipotent structure. But for now, I'm going to stop here after this episode and let all of this soak in. I want to give you some time to sit with it, reflect, and see how it resonates for you. I love to hear how this is landing, and if you're enjoying this format focused on healing and treatment, do you want more of this? Let me know. Shoot me an email. Okay, where did we leave off last time? In the prior episode, I was discussing a patient who, for the first time, was able to notice her pattern of keeping herself safe. I was able to help her see how in relationships, she both longs for closeness, but also protects herself by keeping things, and I quote, fun. From a psychodynamic perspective, this moment of recognition signals something crucial. What is it? It's the beginning of a reflective capacity and an awareness of her own ambivalence around emotional closeness and vulnerability. When she allowed herself to circle back and be vulnerable with her friend, it showed us the grandiose defense was beginning to loosen up. That was the main question under discussion. How do you know when the false self, the grandiose structure, is beginning to loosen its grip on the authentic or true self? That small act was an early sign of change, the emergence of something more authentic beneath that protective shell. But, as I emphasized in that prior episode, the work doesn't stop there. Helping someone mourn the loss of the idealized or grandiose self is a delicate process. If those defenses collapse too abruptly, they can be left facing overwhelming feelings that they're not yet ready to process, sometimes triggering withdrawal, rage, or emotional collapse. That's why, in my work, pacing is important, helping them titrate their exposure to vulnerability or, when ready, contain and integrate these emergent feelings in a way that strengthens rather than shatters their sense of self, if that makes sense. If it doesn't, don't worry. I'm going to go into this in great detail. In this episode, I want to continue exploring this process of change. We're now stepping into the heart of what happens when the false self, again, the grandiose sense of self, begins to break down. These individuals often become quite distressed, not necessarily because they lost something real, but because they're confronting the collapse of a powerful internal fantasy. The fantasy that they are, or one day could be, exceptional, uniquely important, and I quote, great, or finally recognized. I guess I can say that they're losing something real, but real to them. That's the most important piece. The illusion, again to them, is very real, and its collapse feels like an internal death. Why so severe, you may be asking? Because it's the very scaffolding. That's the thing I've been calling a patch. It's the thing that holds together their self-esteem, their sense of meaning, and their emotional survival to some extent. I have literally thousands of examples, moments when the grandiose sense of self, the psychic structure holding these individuals together, begins to loosen, crack, or fray at the edges. In everyday clinical work, I often help patients gently start deconstructing this grandiose scaffolding in subtle, quiet ways, moments of doubt, slips in their perfect facade, or small acknowledgments of vulnerability. These are all the things that I bring to the forefront and we look at very closely. But today, what I want to share with you is an extreme example. Yes, I want to go to the extreme, not because the subtle work isn't important, but because this extreme moment that I want to describe vividly captures the profound psychic stakes involved when the fantasy of being exceptional begins to collapse. In these moments, we see in concentrated form the kind of internal catastrophe many narcissistically structured individuals live in dread of. It's about the terror of falling from specialness into meaninglessness, from imagined greatness into psychic death. So what does it actually look like in the room when someone hits that moment, when the fantasy of exceptionalism collapses and they're left facing the raw pain underneath? Let me share a prototypical clinical moment that captures this. He came in looking deflated, speaking slowly, as if every word was an effort. He said he was going to lose everything, that he was fading. He said that he feels important only in his role as a father, and that too was fading because his son was having behavioral problems at school. The sadness in that moment was profound. We spoke about the collapse of the fantasy that he could one day become truly important, exceptional, recognized, and, for example, and I quote, the best father with a perfect son. His words, not mine. From a psychodynamic perspective, this depression isn't just a mood disorder. And that's one of the mistakes that I commonly see. These patients come to me on a triple cocktail of antidepressive medications that just isn't working, because this isn't just a mood disorder. It's the emotional fallout from a collapsing fantasy of specialness. He's both grieving something he's actually lost, which is what? The grandiose structure, the image of greatness and perfection. And he's grieving the idea of who he hoped he might one day become. That imagined self, the important, exceptional, highly recognized version of himself, is slipping away. And what's left is a painful awareness that the fantasy may never materialize. What are your thoughts about this? If he lets go of this illusion of future greatness, what remains? He's left staring into a kind of internal emptiness, a more ordinary, vulnerable self that hasn't yet learned to accept limitations or have loving connections. His sadness, the grief that wasn't just his, but seemed to seep into the room. That's what I'm trying to capture. And if you've ever been around anybody like this, you know this feeling. Or you yourself, if you've slipped into this, you know how this can really influence the environment around you. And I quote, "It's so sad," he says in a dull, affectless way. In other words, there's no affect. "It's so hard." And now he's emotional. He's raw. He's exposed. He's crying. And this is a guy who never cries. One of the reasons he came to me initially was because he doesn't experience feelings, and he finally discovered that that's a problem. This is what makes this kind of work so powerful and so challenging. I'm not just here interpreting defenses, as I described in more detail in prior episodes. Now, I'm holding the emotional fallout of psychic collapse, the collapse of the grandiose sense of self. You're witnessing someone touch on the edges of a painful truth. I may not be special in the way I thought I needed to be in order to be loved or to feel valuable. What I realized, and I hope I'm making this part clear, because it's hard to put this into words, was that he was feeling the weight of a fantasy. That's the core of narcissism, his grandiosity, an idealized image of himself dying. It's all fading away. Some of you listening may recognize this feeling. Maybe you or someone you know was riding high at work, feeling important, successful, and then suddenly there's a shift. Something collapses. Afterward, you find yourself home in bed or reaching for a drink or numbing yourself because, for example, the stock market went down, or you didn't get the promotion, or a big project fell through, or a good friend of yours didn't return a message. And in that moment, you're not just mourning a setback, you're mourning the loss of a deeper fantasy, the fantasy that you are on your way to becoming something, and again I quote, great, and yes, these words are actually used, great. Beneath the grandiose structure lays a profound dread, perhaps tied to early experiences of helplessness or exposure to overwhelming situations, and the painful recognition that life inherently involves limitations, dependence, and frustrations, right? Unmet needs. When severe, it touches the realm of what we call in my field, in the field of psychoanalysis, this is called, and I quote, annihilation anxiety. That's a primitive, early-rooted fear that without sufficient external support, validation, and containment, the self will collapse or even cease to exist. Working at this depth means stepping into an unpredictable, emotionally charged space where even small movements can stir up profound feelings of rejection or being misunderstood by the patient, especially if you call this loss an illusion or a fantasy, because for them, and this is the thing that I'm really trying to emphasize, this is their reality, and calling it a fantasy could feel to them like you don't really understand. It's a misalignment. It's a lack of empathic attunement. So you have to be really careful with this. And that's why, by the way, you rarely ever hear in social media people getting into the depths of this kind of work with those suffering from narcissism, because it's much easier to condemn them, or when somebody gets to this state of anxiety, they want to cheer them up or focus on things they could do to be more productive. But that's not the kind of intervention that I'm describing here. But that leads to the next question. So how do you help someone survive this kind of psychic collapse and slowly, carefully begin building a sense of self that doesn't depend on fantasy or illusion.
You know, they say teaching is the mother of all professions, but right now it feels like it's happening inside a pressure cooker. That's why we created Higher Listenings, bringing a dose of joy to the future of learning. We're exploring things like why reading may not be obsolete after all, the remarkable connection between emotion and learning, and the real reason students cheat.
It's not a moral failing. It's the circumstances that they find themselves in.
Join us on Higher Listenings, because those who can make a difference teach.
The therapeutic task. When handled correctly, I help patients like this put all of what I've just been describing into words. I help them begin to see and think about how this is not just depression. This is also about mourning the imagined self, the grandiose version of who they thought they were or who they were going to be in order to feel worthy. In other words, they need to be this great, perfect person to feel worthy, loved, or safe. And then I help them begin, often this is very painful, to face the vulnerability of what lies underneath this structure. The work becomes about sitting with the grief or what will never be. Again, I know I just mentioned this, but this is really important. Not prematurely interpreting or pushing them towards positive thoughts, not telling them that you're so negative, you just need to be more positive, but instead helping them metabolize the loss. But wait, you may now be asking, what does metabolizing actually look like? What does that mean, metabolize a loss? Instead of a theoretical explanation, let me answer that question by way of giving you a sense of what this sounds like in the room. For example, a patient may say, again I quote, "It's just so sad. I always thought I was meant for something big, and now maybe I'm not. I keep thinking, if I let that go, then what's left? Who am I without that hope?" At this moment, I might say something like, "That's such an important question. Who are you? If you're not the person you imagine that you would become, what comes up when you sit with that thought?" Again, hypothetically, I'm just playing this out with you. The response may look something like, "I guess I'm just me, just this regular guy with an okay job who's trying, and that's it. And that sounds so pathetic." And then again, at this point, I'm playing this out for you, I may ask, what's it like to imagine being just you, without the promise of being great someday? What does that bring up for you right now? Or I might wonder, if you weren't holding on to this idea of needing to be extraordinary, what do you think you'd start noticing or feeling about who you are right now? Who are you today? These kinds of questions invite him to sit with the ordinariness that he has long avoided. Remember, that's pathetic. It's not sitting with it as a punishment. Again, I want to emphasize that. Once they start punishing themselves, if you hear this, I know when I hear this, then the technique is a little different, that I have to shift to what we call confrontation. So if they're punishing themselves, if they're diminishing themselves, in other words, that they're just pathetic, that has to be challenged. And that's what we call confrontation, which is another technique. Anyway, this is what happens oftentimes when you give them the space and you confront the punitive, what we call the punitive superego, which is a whole nother story we need to get into in terms of the healing process. Interestingly, if you can pay close attention, you start to hear subtle shifts when someone begins to let go of the fantasy. Sometimes a spontaneous memory emerges, as this guy, like this example that I'm giving, he suddenly recalls a wedding he attended this past weekend. So there's the space. You challenge the punitive voice, so you clear all this way, you clear some space, and what emerges is a memory. While he wanted to continue socializing with the guys, this is at the wedding, his daughter was pulling on him to dance. Being able to dance and having the feeling that it was good, I quote, good, he said, he did it and he didn't feel awkward, or he didn't think he was coming across, again, that word, as pathetic. I quote, I was with my family, spinning my daughter around. It was fun. So yes, a fellow like this mentions having fun. This is play. This is not something you often see with these people. A spontaneous memory, such as this one, is very, very significant and loaded with meaning. I can't do justice to it entirely, but let me just mention a few things, okay? First, he was caught between two conflicting internal demands at the wedding. Being a good enough, attentive father to his child and family versus his own self-presentation, his own performance with his friends. He could have stayed with his friends, the guys, being impressive, smoking cigars, being admired, having some alcohol, right? All of which point to being accepted by his buddies. This double pressure mirrors a deep internal conflict between what? Authenticity and relatedness. In other words, being genuinely connected, caretaking. That's being vulnerable with his family. Or what's the double pressure? Or this, grandiosity and defensiveness, being admired, maintaining what? That polished, superior facade with the guys. In psychoanalytic terms and psychodynamic terms, he's struggling with an inner conflict. This is a very positive prognostic sign. Yes, you heard me correctly. So being in conflict is a positive sign. Why? What's so positive about being conflicted, you may now be asking? The goal in psychodynamic therapy isn't just symptom relief. It's to help patients like this, individuals like this guy, develop a greater capacity to hold ambivalence. Ambivalence is that conflict. Ambivalence is good. You see, conflict is good. It's good compared to what? It's better than splitting, right? It's better than entering the grandiose world. So the goal is to help him hold ambivalence, build conflict about feelings around love, dependence, and narcissistic vulnerability. So this is a really important moment. The work now is to help this fellow integrate. And again, you've heard me use this word frequently if you've been following any of the prior episodes, to help him integrate his new experience. This moment challenges his internal working model, his deeply rooted inner representation of himself as what? Great, self-sufficient, not needing anyone. Remember, the narcissist is without needs or vulnerability. Don't apologize. Don't explain. All of that makes you vulnerable. These are the small but powerful signs. They signal that the mourning process is underway. That's the healing process. Again, like conflict, the mourning process is not depression. mourning is underway, and that the grandiose shell is loosening, and that he's beginning to orient toward what? A more authentic, reciprocal connection with his daughter and family. There's no doubt he will slip back into the grandiose sense of self. So again, if this is you or somebody you know, do not get discouraged when they retreat or you retreat back to the drugs, the drinking, the pornography, the grandiosity, the partying, right? This is what we call the psychic retreat. So the omnipotence, you're back there again. At this point, this fellow needs help tolerating his unfamiliar experience. In other words, since I've done this before, I know it's not an upward trajectory. So when you have moments like this, you need to take them and treat them in a very serious way and build on them and bring them to the fore. That's what I mean by he needs help tolerating this unfamiliar experience. The work now is on integration and helping him function in an uncertain, right? An uncertain reality, but a more authentic reality, but nevertheless, as you know, scary. He's in uncharted territory, and we want to help him stay there in these moments. First, we want to recognize and help him recognize that he's there and that he was brave and that he even shared this with you and that he shared that he had a good time. Again, that's a whole nother episode. But for some of these people who are struggling with these narcissistic traits, even admitting that you're helping them is incredibly difficult. But again, that's for another day. So, as you can tell, just by that bit of a digression, there's still so much more to say about this next step and about how we help someone build a self that can survive without the patch. The patch is the grandiosity, the false self. It puts a patch on what? All the things that are now getting exposed, the vulnerability, the connectedness, the uncertainty. But unfortunately, as always, we have to begin to wrap things up. We have to stop here for today. As I mentioned at the beginning, I really enjoyed creating this mini-series on healing narcissism. So I want to ask you, if you found this helpful, please take a moment to let me know. Would you like me to continue and record more episodes specifically on treatment and healing? Believe me, there's a lot more we can explore here. You might have noticed, for example, that I haven't even touched on the role of the inner critical voice. Remember, I alluded to it earlier, but that was just alluding to it. I didn't get into the impact of guilt or the subtle layers of shame that often emerge as the structure begins to break down. There's so little out there focused on specific healing and treatment approaches, so I truly hope this series has offered you something meaningful. On a personal note, it was certainly meaningful to me. I'm excited to continue with it, but again, I'd love to hear from you. Send me your thoughts, your questions, whatever's on your mind. All right, until next time, bye for now. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.